So do you have pain in between your shoulder blades or under your shoulder blades, or you feel like if someone could just push your chest back, it would make it really feel good? This has to do with your shoulder blade stabilizers or scapular stabilizers, which is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Irvine Spinal Wellness Center, your Irvine Posture and Chiropractic Clinic. Pain between the shoulder blade is actually a lot more common than you realize. And what I've started noticing in the practice is so many people don't want to have this posture. So what they do is overcompensation. So what they're doing is military posture, and they're sticking their chest out. And in the process, they're actually creating a lot of dysfunction around the shoulder blade stabilizers. So great exercise to actually work some of those muscles has to do with this. I'm going to use Desiree as my model. So she's going to be, you use a yoga, yeah, this is good. So you're going to use like a yoga block or something. And for this, again, there are certain requirements. We're not interested in duplicating moves. We're interested in doing the moves properly and functionally. So what needs to be in place is actually proper breathing technique where your barrel's engaged. We're going to make sure that we put that video at the end of this video so you can understand what we're talking about. Your stabilizers, which is this rectangle, is nice and square. Your spine is neutral, so you're not kyphotic with excess curve or lordotic with excess curve or archback in the lower back, so you become neutral. Your pelvic diaphragm is engaged, and you notice that you're making a fist, but really you're not making this area roll forward. It's or kyphotic, thank you. So it becomes, you know what patients do, so she's duplicating what we deal with every day pretty much. So the back is, the top of the thoracic spine is nice and flat. You're on the block on one, you're really utilizing all of your arm and forearm muscles to lift you up, and you're gliding your neck up, and the other hand is on the floor. So you're actually exercising, in this case, the right side of the shoulder blade. So go ahead and do this properly, where you're pushing off with the hand that, or the arm that is not on the block, and on this side you're lifting the arm up. Just see, I can move this just enough. That's all activation of these muscles here. You need to make sure your feet are nice and flat on the floor, and you're actually using your legs to support the junction of the thigh bone to the pelvis. So maintaining that barrel, that proper neutral spine is in place, so we can effectively and properly engage the musculature around the shoulder blade. Also make sure your head does not dip down, because that will take away the workout. So it needs to be gliding up. You're pressing down on the hand on the floor. Meanwhile, you're engaging these muscles just to lift it up. Thank you so much. It's not as easy as it looks. So give it a try. What muscle are we using in this exercise?
Serratus anterior.
That's right. So you need to make sure your serratus anterior, which is probably one of the most challenged muscles when you're typing away, is getting proper workout. If you have not subscribed to the channel, this is the time to subscribe. And if you have any questions, or if you need to make an appointment, use one of the methods of contact in the description box. Thanks for watching. Take care.